I do see every kind of like setback or challenge that I've been dealt, whether it's having one arm or having bipolar disorder, I do see them as gifts because I've learned so much from them. They've brought me closer to communities of people that I might not have otherwise known.
Infertility and mental health are intertwined. Not having your family on your terms or how you expected can be full of emotions like sadness and anger. And the treatments themselves can be stressful, disruptive on your career, relationships, and the life you're living. Support for mental health through the process is important. I've been following our guest for years as a contestant on The Bachelor for 3 seasons, her own fertility and IVF journey on social media, and I was blown away when she revealed her own diagnosis of bipolar disorder on an Instagram post. This gorgeous, bright, inspirational woman is not afraid to get vulnerable. Sarah Herron, thank you so much for being here on Baby or Bust.
Thank you.
In social media in general, usually people are just showing like this, the highlights of their life. And you are a beautiful woman, hiking, and Dylan is just a lovely person. I think people will respond to you being like, hey, there's hard things and let me share some of them. And you've done a great job of sharing a lot about your mental health as well as fertility. Which came first, the infertility piece or the bipolar disorder?
My journey with mental health came first. It all started about 3 years ago, almost. We're coming up on the anniversary. I'm not exactly sure, when this episode will air, but around the 3-year mark of when I started seeking treatment for my depression and anxiety, which was then diagnosed bipolar type 2 disorder. And I've been sharing it ever since. But the fertility journey came, I guess, 2 years ago. So really, they kind of coincided.
How did you know it wasn't, not that there is run-of-the-mill feeling down or sadness or anxiety, but how did you know that you should probably seek a little help?
Growing up, I always felt like I was someone who experienced emotions intensely. I cried a lot as a kid. I had anxiety, but I didn't know how to name it. I didn't know what it was. I just felt like something was kind of off with me and that I felt things more intensely than my peers. Then about 3 years ago, my depression and anxiety just started to get pretty bad and everything came to a head. I was also simultaneously running a nonprofit called She Lift at the time. And I was out doing the things that I love doing, like hiking and spending time in the outdoors. And I started having really intense, intrusive thoughts. And they really started to just disrupt my day-to-day life. I couldn't do the things that I loved doing. And so, for me, what it looked like was being out on a hike and I would have this horrible visualization of being attacked by a mountain lion. I know saying it back, it sounds kind of silly, but when you have these types of intrusive thoughts, they feel real. And it was terrifying and it was real for me. And so I decided, I had to get some help for it. And I asked a friend for a referral to a therapist who I'm so grateful for because she's amazing. And I've been working with her once a week, every week for 3 years now.
How did you know it was bipolar disorder? What is bipolar disorder?
Okay. We kind of arrived at the diagnosis pretty quickly. I think I started working with my counselor end of September, and by early October, I had also met with a psychiatrist. And so I had done all of the evaluations and, talked about my upbringing and my background and just talked about a lot of my symptoms. And at first, my psychiatrist was she didn't believe in giving a hard diagnosis. She was we see signs and tendencies of bipolar type 2 disorder. So let's treat that through the use of therapy and medication. And in the back of my mind, when I got that diagnosis, honestly, I was I knew it. I was kind of relieved. It feels like a little bit of a weight off your shoulders because you just feel a little bit validated. And it kind of just made sense that for all those years, it's oh, that's why I feel feelings intensely. And that's why I'm highly creative, and that's why maybe I've had some of these manic tendencies. It did give name to a lot of the experiences I had had growing up, and in many ways it felt validating.
It used to be called manic depressive disorder, and it's sort of the mania is being sped up and just hyper focused. And if you are a creative person, like using all that energy, like some of the most talented and highly
Mm-hmm.
productive people that we revere in society and in history probably had bipolar disorder, but it can be associated with these really high highs and really low lows of depression and
Yeah.
feeling inability to kind of do things. And that's part of you sharing. Like if you just saw, like went through your Instagram feed, you'd be like, oh my gosh, she's gorgeous and she's been on The Bachelor and look at her doing all these things. And you can say, oh gosh, like if she can have this, then really like anyone can. And I hope that this encourages people that are feeling that inside something must be off. I hope that they will take the time to ask more questions and seek that support.
Yeah, and you're absolutely right. Like, not everyone is going to feel relief from getting a diagnosis right away. But I guess my hope is that by sharing, also, we can just like destigmatize bipolar disorder, because I certainly think, in my generation, millennials, like we grew up, and it has a really stigmatized, bad connotation. And the reality is, like, it's a challenging disorder for sure, but with the right care team and support and medication, if you choose to use it, it's not something to be afraid of. Now that I know what it is and I know how to manage it, I'm not afraid.
A lot of people in your generation might just think of Britney Spears
Mm-hmm.
shaving her head and going after a car with
Mm-hmm.
a umbrella. Like that might be their only introduction to
Yeah.
bipolar disorder. And so just shattering that stigma is just really, really important.
I've learned to see it as like my super strength when I can. And it's like, oh, well, my mania hasn't always been all bad. Sometimes it leads to like very highly productive, periods of time. And I created my nonprofit essentially out of a manic phase. um, so, it has some of its gifts with it too.
Yeah, I've heard you describe your bipolar disorder as a gift.
It's so weird. I don't know if people would agree with me, but like I do see every kind of like setback or challenge that I've been dealt, whether it's having one arm or having bipolar disorder, I do see them as gifts because I've learned so much from them. They've brought me closer to communities of people that I might not have otherwise known. And I'm just someone that likes collecting information, and I like collecting information about myself and other types of people. And so the more I can understand myself and other walks of life, to me is like a gift. I just want to know and understand people.
Did these things make you more prepared for infertility, which is a huge challenge?
I'm more resilient these days than maybe I was in my early 20s. And so I wouldn't say like having one arm or having been through a bipolar diagnosis made the brunt of infertility easier, but I've learned to be a little bit more resilient in getting some of those setbacks, and learn to become more resilient and, relying on my partner.
How did you know that infertility might be a challenge? Tell us a little bit about your journey.
So it's so wild. I mean, like Dylan is my fiance, and we have been together for 5 years, but we had been together for 3 years, I guess. And I just knew one day, like, I was ready to start trying to have a baby. We weren't engaged, we hadn't talked about marriage yet, but that light switch just went off. And so I went to Dylan and I said, I am ready to start trying to have a baby. Like, you're either on board or are you not? I want to know. And he was like, yeah, that sounds like a lot of fun. We should do it. And we were like, okay. So given that I was born with amniotic band syndrome and had bipolar disorder, we wanted to have a consultation with my OBGYN just to discuss, like, should I come off my medication? Should I stay on my medication? I know that there's no hereditary association with amniotic band syndrome, but still we just wanted to have this meeting with my doctor.
And can you explain what that is?
My understanding is that there's like fibrous material or something in the amniotic sac that these little fibers or these little hairs can kind of attach themselves to babies' limbs or sometimes like across their face. And essentially, the limb kind of like gets amputated or can't continue to develop. And so sometimes babies are born without their fingers or their
Mm-hmm.
arm or sometimes, like I said, across their face or their lips.
Yeah. And it's not something that's genetic or you could test for or anything that anybody, did wrong in pregnancy.
Mm-hmm.
And it can be diagnosed with ultrasound kind of before delivery. It's rare. And I love that you were asking questions before you were actively trying to conceive. And I have so many patients that come to me preconception thinking about freezing eggs or thinking about,
Mm-hmm.
starting to try. Sometimes they've already stopped their meds,
Mm-hmm.
before they come see me. And I'm like, oh my gosh, no. I think the assumption is that you should stop mental health meds, whether it's antidepressants or just anything, because it might be an issue in pregnancy. And I would love to talk about that because I think it's got to be a very serious discussion between the psychiatrist and the
Mm-hmm.
therapist and the OBGYN and the fertility doctor, because I think that truly it's better for mental health to be in check and taken care of rather than stopping something that has maybe a theoretical risk. It's just not one black and white decision.
That's it, the exact same feedback that we got from my therapist, my psychiatrist, and my OBGYN. I mean, everyone said that the very small risk of staying on the medication wasn't worth the risk of coming off and potentially going into a manic episode when you're pregnant or just having a fluctuating nervous system can also just be harmful to the baby's health. So we just decided that it was better to stay on the medication. And I'm actually no longer on medication today. I did end up coming off about 6 months ago, but it was unrelated to coming off for fertility reasons. It was a gradual, long process of like arriving at a place where I felt comfortable to come off the medication. And since we weren't in the middle of an IVF cycle, it felt like the right time. And I had a big enough window to properly come off the medication so that it wouldn't be like abruptly during a pregnancy. And that if I needed to get back on meds, I would have time to do so before becoming pregnant.
Actually, abruptly stopping your medication can increase your cortisol levels and inflammation and actually really might affect fertility. Again, this is a really individualized decision, but it was incredible to just see a different side of it. And I think
Yeah.
that society's assumption is medication is bad and you have to be off of it.
Also, I would like to point out, there was a moment during working with Dr. Amy, I think on like maybe my second egg retrieval, I considered coming off meds and we discussed it with Dr. Amy. I should just point out, she said she was in agreement with everyone else, but she pointed something out to me that I hadn't considered is that if I were to have come off meds without telling her, that also affects or could potentially impact the way she's treating me and the medications that, like her protocol. And so it's just important to know that, like, if you are someone maybe going through IVF and you want to come off your meds, like, don't forget to talk to your IVF doctor about it because, like, they're also taking all of your hormones into consideration with, the way potentially like antidepressants. I'm not even sure, but like I'm sure all of that plays a role in blood work. Bipolar can be passed on, but I feel very confident in the work that I've done with therapy that I don't believe I will pass it on because of what I'm learning. Like, I think so much there is a chemical component of bipolar disorder that's not to be like ignored. There's definitely a chemical element to it, but a lot of it is behavioral and learning how to regulate your nervous system and also just a lot of like our childhood upbringing. And unfortunately, like I just didn't really have the tools. I wasn't given the tools to, regulate my emotions as a kid. And, I come from a divorced home and I just don't think I always got the emotional support I needed. And so what I'm learning is, as a parent, like, I will do everything to give my kid the resources and tools to like feel their emotions and express their emotions. And if it is passed on, like, then we will get support for it.
I hope
Yeah.
that anybody that has a mental health issue isn't not trying to be a parent because they're so worried about that. Like, please get your questions answered
Yeah.
rather than just assuming that you're going to pass this on.
Yeah. Thank you. You said that better than I did, but you're exactly right. You know, I do think any mom who's already thinking that way will be a great mom and will provide their child with the access to all the tools that they can.
So you had your preconception visit, just
Yeah.
started trying, and it happened the first month, right?
Right away, very first try. No, not at all. I was tracking my ovulation and everything was like clockwork, like it was too perfect, but I wasn't getting pregnant. And we tried for 7 months and it just didn't make sense. So that's when my OB said, yeah, after 6 to 7 months, come back in. We'll do a panel, we'll run your blood work and hormones and check for everything. So at that 7 months, I went in, we did the blood work. I don't know if I just had kind of a unusual experience, but you know, when my doctor came back in, she literally walked back into the room with pamphlets on IVF and some referrals to doctors. And it just felt like I was met with some weird emotions about it. I felt like I was being handed off as like expired goods. It hit me in a way that I wasn't expecting. And it felt way worse than what it actually is.
Yeah, you are not the first person that's explained that. And I'm sorry that that was your experience. But I will tell you, you know, most primary care doctors or OBGYNs get like this much, and you can't
Yeah.
see, but like a tiny, tiny amount of fertility training. And so the right thing is to get the patient to a specialist like me and like Dr. Amy that can really interpret these and like help the patient think through things. But man, the delivery can be really
Yeah.
tough.
It's okay now, but yeah, it was a really tough day because you just go from being on this excitement of me and my partner are trying to have a baby and you get this bad news and all of a sudden you're like, here's a pamphlet for IVF. And all I knew at the time was, oh my gosh, IVF costs hundreds of thousands of dollars. Like, this isn't possible. This isn't happening. So it was a lot to process. And honestly, it's like kind of a blur because I just remember you come home and you're so sad. And I had to tell Dylan and he was sad. And it was a grim couple of days. And now being in the place where I am, I know so many women feel that way too when they first find out. And I just wish I could like lift everyone up and hug them because I know that feeling of devastation. But I truly feel like there's so much hope, you know, through fertility treatment. And it doesn't have to be like a, you know, a life sentence. There's so much beauty on the other side and there's so much amazing community. I know I always say the community part, but I just love the strength that I found through people in this community.
Infertility is not a club that you necessarily want to join, but
Yeah.
if you're lucky enough or unlucky enough to join, there's a lot of support to kind of help navigate. Has the process been okay for you? Or are there any bumps in the road with like the shots or just the recovery?
The only real bump in the road that I have is my body does not like progesterone in oil. So I've done 3 now. I've had 2 transfers and 1 mock cycle, and I always develop an allergic reaction to the PIO. And so we've switched oils, we've done only vaginal inserts. And so I don't know if I'm maybe, you know, we haven't talked about it more. I don't know if I'm having like a sensitivity to progesterone, if I'm like one of the rare people that has progesterone hypersensitivity or something, but I get mild hives. And so it's been fine and manageable. I have to take Benadryl, but that's been the only hiccup. So after my first transfer ended in chemical pregnancy, Dr. Amy suspected that potentially I had endometriosis. And so we did the Receptiva DX test, which can kind of like screen for potential endometriosis. And so sure enough, we said, okay, I should probably have a laparoscopy. And I did end up scheduling that within about 6 months of Dr. Amy recommending it. And I saw a surgeon here in Denver, Colorado. So I was able to do that locally. And the surgery was very easy. They only found stage 1 endometriosis, which was, I guess, good enough to be like a little validating. But I think sometimes when like you have infertility and the transfer didn't work, you're kind of hoping that they're going to be like, a miracle, we found, stage 4. No wonder you haven't been able to get pregnant. And that just wasn't the case.
It's interesting. The stage is like how much inflammation or how much endometriosis I find. But honestly, some people can have like really significant scarring and like stage 4, and it's just all throughout the pelvis, and they have no issues with fertility.
Yeah.
They have no pain with periods. They had a surgery for some other reason and it's discovered. And then other people can have infertility and symptoms and things like that. And you look and you're like, it's no big deal. It's just stage 1. You should be validated that you figured that out and that you're addressing it.
It was like day before going in for my surgery, and Dylan was like, so like, what exactly is endometriosis?
You're really hitting on something here where sometimes even the people that love you the most, you're having to not only share information but like educate them at the same time, right? Mm-hmm. Like, and you're like, I just want support. I don't want to give you like a 10-page lecture on what endometriosis is, but
they mean well, but it's tough. I think, when someone taught me like the best thing you can do to support your friend or your loved one who's going through fertility challenges is to research as much as you can for them, so that you aren't like bombarding them with these questions, and so that you can kind of show up to support them. And you don't have to have a full understanding of everything, but just like, I looked up what endometriosis is, just to have a better understanding of what your friend might be going through is a great way to start if you're someone that is looking for how to support.
You have had multiple retrievals, you've had multiple transfers. How has the roller coaster ride impacted your mental health?
I was doing back-to-back retrievals and transfers for almost a solid year, consistent year. And by the end of that year, this would have taken me up to like March of 2022, was really tough. And I just needed a break. I needed to step back, and I needed to like stop taking hormones for a little while. So we did take a break from April until August. And by like June and July, I started feeling like myself again. My body was kind of bouncing back a little bit. And it was the exact like break that I needed. It just reminded me of like what it feels like to be not on hormones for a long time. It reminded me what it's like to just not be obsessing over everything I'm putting in my body or what I'm not putting in my body. And I just want to acknowledge that it's tough, it's challenging, and it was hard for me. I think one of the things that I struggle with a lot is I also am recovering from an eating disorder from when I was in high school and college. And so a lot of like the body changes that take place when you're on back-to-back IVF cycles is difficult for someone who's recovering. Mm-hmm. And that's kind of been like the hardest part, I'm not going to lie. But I've been able to, like find support, and I'm grateful for that team that I keep talking about, but that's kind of been the hardest part.
A lot of my patients have had eating disorders on and off throughout, and there's a lot of triggers that come up through fertility treatment. And it's not just the bloating or the, body changes that happen. It's also going through the fertility process, you feel so out of control. Mm-hmm. And what you put into your body or how much you exercise is something that you can control. And so if you've used that as a coping mechanism in the past, this process of feeling out of control, it can absolutely get triggered. How have you found ways to support, or whether it's like, when it's happening, like what do you do when you're feeling that?
Well, I have about 2 friends on speed dial who I can speak to very candidly about, when the eating disorder voice gets loud. And one of them is my best friend. She's been my best friend since 7th grade. So she's seen it, she's been through it all with me. And she just reminds me that like the ED voice is a liar. Like it is not true, that this isn't truth. And then secondly, I work with my therapist. We always have a plan going into IVF cycles. Dylan and I rely very strongly on meal delivery service programs because my tendency is like when I'm starting to feel bloated or uncomfortable in my body is to restrict, because that's what I can control, like you said. And so if there's meals planned for me, if I don't have to make decisions about it, if I can just make things one step easier for myself to make sure that I'm still nourishing myself and still getting fed. So I just have to have a plan in place. I have to remind myself that like the ED voice that is getting loud at times is a liar. It's not truth. And I just have to keep, that care team on speed dial. And I do just remind myself that it's all temporary, because it really is. It can be hard some days, and then you wake up 48 hours later and you feel totally different. And so
and have that support team and kind of think through the triggers, and having a plan is really, really important. It's when we are hiding it from our loved ones or our therapists or our doctors that I get the most worried. It's the sharing that can be really helpful, even if it's hard. It can be really hard.
No day is going to look perfect, and your team isn't always going to have like the perfect solution, but I think just taking things one day at a time is what you have to do. And it is hard to be like truthful sometimes, but like my therapist, Dylan, my best friend, everyone just helps be my strength sometimes when I can't be. So it's just very important that we let people in on that struggle, because we don't have to do it all alone.
Tell me about She Lift.
She Lift is a nonprofit that I started shortly after coming off Bachelor in Paradise, actually, so in 2016. And ever since I first appeared on the show, I started receiving a lot of fan mail from little girls or their moms or their family members who had limb differences like me. And they would write me telling me about how like they had never seen someone that looked like them on a TV show like The Bachelor. And it was kind of overwhelming at first, because I was 25 and I had just come off this TV show and I didn't know what I was supposed to do with, all these people who were messaging me. I had certainly never seen anyone that looked like me on television. Then I went on Bachelor in Paradise, and the following just continued to grow and grow and grow. And by the last time I was on the show, let's say I was like 27, and I was like, you know what? I have an opportunity here. There are countless young women out there who are born with a limb difference, who are probably experiencing insecurities and self-doubt the way that I have. I mean, here I've shared pretty much all of it with you. And I was like, I want to help these young girls to feel seen, to overcome some of these self-esteem issues. And I want to help them achieve that through recreation and spending time in the outdoors like I love doing. So I started a nonprofit, had no idea what I was doing, and just decided I'm going to start hosting these retreats for young women, and I'm going to take them skiing and hiking, and we're going to do all the things outside to build community and confidence through the outdoors. And the organization took off. We were very successful in running programming for about 4 years, and then the pandemic hit, and everything has been on hiatus. Since then, also in between came up with like my fertility, my mental health. And so it's just been on pause. I needed She Lift as much as the people who, benefited from the organization needed it, because it taught me so much about myself and compassion for other people. And we're all still just learning. I'm learning about disability still to this day, even as a 35-year-old woman with a disability. And it's a beautiful organization, and I hope once I kind of like get pieces of my life back in order, maybe we can resume more programming. But I'm grateful that I had the opportunity to create something for a few years.
It's beautiful. Sarah, anything that you wish you knew earlier, or encouragement to anyone that might be facing mental health challenges or fertility challenges, or both?
My biggest piece of advice that I offer people is to find community, to find support. I never was somebody that, joined Facebook groups or support groups before getting into my fertility journey. But when I did start joining these groups, like, I just found strength in numbers through everyone else. And they say, like, you're an IVF warrior, and it's so true. And you can find a whole army of people to support you. So
such a joy to connect with you. And I'd love for people to know how to find you.
You can find me on Instagram at Sarah Herron. And then my website is sarahherron.com.
Great. Thank you so much.
Thank you. It was a pleasure. I'm glad we got to talk about so much.
I hope you enjoyed that conversation with Sarah Herron as much as I did. I have truly enjoyed following her for years on multiple seasons of The Bachelor and through her social media. And what I enjoy the most is her ability to share her challenges along with hope, and specifically her challenges with mental health and bipolar disorder and her fertility journey. And a common thread and recommendation that she always leaves us with is the importance of community. Finding that support network, whether it's your physicians, your therapist, your partner, this incredible fertility community is a way to find support and to help you face your challenges one step at a time. I'm your host, Dr. Lora Shahine, and this is Baby or Bust. If you like this episode, let us know. Give us a 5-star review and follow the show wherever you listen to your podcasts. Baby or Bust is produced by Mark Ramsey, Jamie Solis, and Greg Moga. Executive produced by Paul Anderson for Workhouse Media. Baby or Bust is a Mark Ramsey media production.